Welcome back, everyone, for another deep dive. This time, we're heading over to Idaho. Seems to be at a real crossroads right now, especially when it comes to healthcare and education. A lot of big changes happening over there.
Yeah, it's definitely a really interesting time to be looking at Idaho. I mean, huge legislative shifts lately, and those are going to have a big impact, on people's lives.
Absolutely, and that's what we're going to be digging into today, right? What kind of Idaho was being built with these new policies? We've got a lot to cover. The Medical Ethics Defense Act, the Parental Choice Education Tax Credit, what's happening with Medicaid, and the big changes for virtual education.
A lot on the table. And it really touches so many different aspects of life in the state, too.
Exactly. So let's jump right in. We're going to start with healthcare
Mm.
and specifically this Medical Ethics Defense Act, also known as House Bill 59. So basically, this law is saying that healthcare providers, doctors, nurses, pharmacists, even entire institutions, they can refuse to provide non-emergency services if it goes against their deeply held beliefs. Could be religious, moral, ethical, any of those.
Right, and the supporters of this bill, they really frame it as a matter of protecting freedom of conscience. Like Senator Carl Bjork said, no one should be forced to participate in something that fundamentally violates their beliefs.
I could see that side of it for sure, but
Yeah.
it also seems like there's a lot of potential for this to impact access to care, especially if a patient's needs clash with their provider's beliefs. Like Senator Ron Taylor brought up, what happens when someone can't get the care they need because of someone else's personal views?
Yeah, and that's a big concern, especially when you think about rural Idaho. Many areas already struggle with limited healthcare options. Imagine, the only pharmacist in town refusing to fill a prescription for contraception because it goes against their beliefs. That puts the patient in a really tough spot.
Definitely. And it's not just a hypothetical situation either. Miski Delacarpini-Tolman, who heads up Planned Parenthood in Idaho, she's been very vocal about this. Her worry is that people will be denied essential health care simply because of someone else's personal beliefs. And that's a real problem.
It is. It raises serious questions about discrimination, too,
Right.
particularly for LGBTQ plus individuals, women seeking reproductive health care. It's a slippery slope.
Absolutely.
Yeah.
Okay, so moving on, let's talk about Medicaid. Now, Idaho voters approved Medicaid expansion back in 2018, but fast forward to 2025, and there was a real push to repeal it with House Bill 58. A lot of the arguments centered around, fiscal responsibility and all that.
Yeah, and those concerns about state budgets and federal funding, they're definitely legitimate. But the other side of the coin was the potential loss of coverage for so many Idahoans. And that's not to mention the millions in federal funding that would disappear too.
It sounds like it was a tough decision for sure.
It was, and ultimately the repeal effort stalled. I think that shows just how much support there is for Medicaid expansion in Idaho.
Mhm.
People see the benefits, especially for rural hospitals and for families who rely on this coverage.
So expansion stayed, but there were still changes to Medicaid. Work requirements ended up getting approved.
Right. And those requirements, well, they can be tricky. They often involve, working a certain number of hours or actively looking for a job to keep your Medicaid coverage. And studies like those from the Kaiser Family Foundation, they've shown that these requirements often lead to people losing coverage, even if they're working or trying to find work. It creates this extra layer of bureaucracy that can be really difficult for people to navigate.
Especially for those who are already struggling. Right. Exactly. All right, so let's shift gears again. Time to talk about education. Starting with House Bill 93. This one is all about the Parental Choice Education Tax Credit. Basically, it offers parents a refundable tax credit if they choose private or homeschooling for their kids, up to $5,000 per student or $7,500 for students with disabilities. There's a $50 million cap on it, though.
So that's a pretty significant chunk of change.
It is.
Yeah.
And, the idea behind it is to give parents more control over their kids' education, more freedom to choose what they think is the best environment. House Speaker Mike Moyle, he put it pretty clearly. He said this is about empowering parents and ensuring their right to choose how and where their children are educated.
Sounds good in theory, but you have to wonder about the impact on public schools, right? The Idaho Education Association, they've been pretty vocal about this, worried that it's going to drain much-needed funding away from public schools, which, let's face it, serve the vast majority of Idaho's kids. Yeah, that's the big question. Where does the money come from? And there are concerns about accountability, too,
Yeah.
Private schools don't have to follow the same rules and regulations as public schools.
Because there's less oversight.
Right. And then you have to think about the impact on rural communities. The Idaho Center for Fiscal Policy, they pointed out that many rural counties don't even have private schools. So this tax credit might not actually benefit families in those areas. Even Governor Little, when he signed the bill, he talked about the need for accountability for private schools to make sure they're actually delivering on their promises.
So it's not just a simple yes or no kind of issue.
Yeah.
Lots of nuances there.
Definitely. Okay, and then there's the whole overhaul of virtual education to talk about, too. Senate Bills 1176 and 1188. What they do is they centralize all the oversight for virtual schools under the Idaho Public Charter School Commission, and they actually stop local school districts from offering online programs outside of their own district boundaries.
So if a district has a really successful online program, they can't share that with students in other districts anymore.
Right. And the reasoning behind this is to make sure there are consistent standards across all virtual schools and to, keep things accountable. But groups like the Coalition of Idaho Charter School Families, they're worried that this could actually limit choices for parents and potentially harm some really good online programs that were working well before.
It's tough because you want to ensure quality, but you also want to allow for innovation and flexibility.
Absolutely. And you have to remember that online learning is especially important for students in rural areas or those who have unique needs that might not be met by traditional schools. So it's a complex issue for sure.
So we've gone through a lot of information here, but it's important to remember that these aren't just abstract policies. They have real-world consequences for real people. Imagine someone like Sarah. She's working part-time but struggling to make ends meet. Those new Medicaid work requirements could mean she loses her health coverage even though she's doing everything she can.
Exactly. Or think about Ethan. He's thriving in his online charter school program. He loves the flexibility it gives him, and he's learning so much. But with these new rules, his school might not be able to operate anymore, and he'll be forced back into a traditional classroom setting that doesn't work as well for him.
And then there's Maria. She lives in a rural community where healthcare access is already limited. Now with this Medical Ethics Defense Act, she's facing even more barriers to getting the care she needs. It's really concerning.
These examples just show how important it is for people to understand these policy changes and how they could impact their lives and the lives of their families and neighbors.
It feels like Idaho is at a real turning point. So much is changing so rapidly. What can people do? How can they get involved and make their voices heard?
Well, first and foremost, stay informed. Know what's happening, know what these laws mean, and how they could affect you and your community. There are some great resources out there. Organizations like the Idaho Center for Fiscal Policy, they're doing great work analyzing the impact of these policies. And news outlets like the Idaho Capital Sun and Idaho Education News, they provide really insightful coverage of what's going on in the state.
We'll be sure to include links to all of those resources in the show notes.
Perfect. And, once you're informed, reach out to your elected officials. Let them know what you think. Share your stories, share your concerns. Your voice matters.
It really does. And it's not just about contacting your representatives. It's about talking to your friends and neighbors about these issues, spreading awareness, getting people engaged. The more people who understand what's at stake, the more powerful the collective voice will be.
Absolutely. And, ultimately it comes down to this. What kind of Idaho do we want to live in? What values do we want to see reflected in our laws and policies? And are we willing to fight for those values?
That's a powerful question. And it's one that every Idahoan needs to be asking themselves right now, because the future of the state is being shaped right now, and it's up to all of us to make sure it's a future that works for everyone.
Well said. I think that's a great place to leave it.
Thanks for joining us for this deep dive into Idaho. We hope you found it informative and thought-provoking. We'll be back soon with another exploration of a state facing critical decisions. Until then, stay engaged and stay curious.